Welcome to Joa Fitness Health Wellness Video Podcast, a space to ignite your day through positive conversations. We bring people that have created excellence in their life, sharing high vibration in their reawakening path.
Hello, you're listening to Back into Alignment podcast. My name is Joa Rivas, and I am excited for another talk about spinal health. I am a yoga and Pilates teacher from 2010. And if this is your first time listening to this podcast, I am welcome you to actually get ready to get amazing solutions and the latest technologies that have been applied for our body, especially if you are experiencing neck pain or perhaps lower back pain, or even if you have sciatica. All these issues could be actually treated, as you know, but the most important is to become aware what's happening to us. And one of my missions is to spread the voice of body awareness through healthcare professionals that come to this podcast to share what they are doing in their communities to support people in pain. So today we have the last talk with Dr. Ernest Pecoraro. He's actually in New Jersey in USA. And we've been talking for the last 3 episodes about the EPIC technique. EPIC technique is being revolutionary for those experiencing back pain. And it's actually a really interesting technique that I am open and actually I'm so excited to try it. I'm gonna have to take a flight to New Jersey and be able to see this approach, and maybe my scoliosis and my bulging disc and slip disc and all my pain is gonna melt away with this technique. Who knows? I'm actually really excited. But let's just first introduce Dr. Ernest Pecoraro. How are you?
I'm fine. Thank you for having me on. And I'm excited to discuss our topic today.
Yes. Well, if this is the first time you're listening to the podcast, let's learn about Dr. Pecoraro. He is actually a doctor that came back after more than 20 years of practice because his own daughter had a lower back pain, and he was surprised how a specific technique helped her to reduce lower back pain. And he actually, from retirement, he came back to fully on service one more time to support the community. And he was just telling me, Joa, the EPIC technique, my clinic is doing so great with this technique. It's giving so many great positive feedback, and I'm not sure what to do. I may have to start teaching this to more chiropractors, to more doctors, so they can actually bring this solution to more people in more places. So he's in New Jersey. He's actually really devoting his time to share this technique that has been perhaps ignored or perhaps not brought to the masses like it's supposed to. So tell us a little bit more about EPIC technique and the difference of EPIC technique and any other approach in the chiropractic practice.
Okay. Usually a chiropractor will adjust different parts of the spine. Like if they have low back pain, the patient, they will work on the lower back. If they have neck pain, they work on the neck, or if they have mid-back pain, they work on the mid-back. With EPIC technique, we work on the top bone of the spine, which is called the atlas, because it's like the Greek god who held up the world on his shoulders. The atlas holds the head, which is 14 to 16 pounds. So the atlas has a lot of nerves going to the brain and away from the brain, and a lot of blood vessels going to and from the brain. So it's a very, very important part. In EPIC technique, we concentrate on finding out how the atlas is misplaced and the effects it has. And then we use a certain protocol to measure how that atlas is out of place using spinal engineering technology on the x-rays, and we get coordinates, and then we input them into our machine that shoots a sound wave to move the atlas back into its place where it should be.
Mm-hmm. So this technique that gives miraculous results is the cutting edge of sound wave technology. And sometimes the students, actually the patients, don't even feel that the technique has been applied. And it has been giving so many great results as to ailments, as we actually commented before, like migraines, like headaches, and neck stiffness. But today we're going to be talking about TMJ. TMJ is actually one of the most common problems that everyone is experiencing. If you have a sleep apnea, maybe perhaps related to the TMJ. So tell us a little bit about how recurring is this issue and how many patients you normally see on the monthly basis.
Well, I'm very surprised because when I started this technique, I was expecting back pain, headaches, neck pain, things like that. But so many patients have been coming in. There's over 10 million people in the United States who suffer from pain in the jaw, which is the TMJ, temporomandibular joint. And I think it's much more than that. It's probably double or triple that amount of people, because we have people come in and they're complaining of headache and neck pain, but they say, and also my jaw hurts, and I have problems with chewing, and I feel my bite is out of place, and I have soreness there, things like that. So this is all related to the atlas bone being out of place, and we found amazing results. We had a woman just yesterday came in, and she was having pain in her jaw for like months, and she got a dentist to put like an apparatus in her mouth so she wouldn't like grind her teeth during the night. And we gave her first treatment yesterday, and she immediately got up from the table and said, my pain is gone. I feel great. So this is the kinds of things that's occurring with this.
Mm-hmm. So the TMJ, as you were commenting, is an issue on the tightness on our jaw, and it's also correlated to issues bigger than this, like a migraines, a stiffness on the neck that can actually affect our vagus nerve, which actually will increase our anxiety and the fuel on blood to our brain. So the brain-body connection is so important, and sometimes we forget how a tight jaw can create a very decremental flow towards the brain. So why don't you tell us a little bit about the connection between the brain body and the jaw?
Okay. When the atlas is misplaced, it puts a lot of pressure on the trigeminal nerve. The trigeminal nerve is a nerve that goes into the face, and the motor part of the nerve, that controls the muscles of the jaw, it gets affected if the atlas is out of place. So the atlas gets misplaced, and over a period of time, the jaw starts to, just from normal eating and things, will start to shift. And then the pain will get worse on the other side, because now it's shifted to one side, the other side, the muscles are being stretched out. So we find how the atlas is out of place. There are a bundle of nerves from the trigeminal nerve right at the level of the atlas and the spinal cord. So if the atlas is rotated or off to the side, it puts tension on the trigeminal nucleus there, those bundle of nerves, and it causes jaw tightness and pain.
Okay.
So that's what we work on.
Mm-hmm. So basically, actually, instead of thinking about the jaw, we can actually go even deeper, thinking about the neck position, especially the atlas that you were commenting, and it's giving great results, like this case of this woman that was experiencing jaw TMJ, and then within one session of EPIC technique, realigning the atlas, she already saw a difference in the incremental of the pain. My question is related now to the posture. Do you find that because we are constantly sitting, what was the profession of this lady, if you can actually share with us? What was her profession?
She was actually a retired woman, so she wasn't
Working.
actively working. Yeah.
Do you find that those people that are sitting in front of a computer, because we have a head forward posture, we perhaps tend to change the position of the atlas, which creates all these deficiencies in the body?
Yes, that's very true, because if your position is wrong, or you're looking down at your cell phone a lot, or looking down at your computer, it's going to throw the atlas out of place. But one more important thing is there is a little bone that sticks out right by the atlas, and it can get calcified. It's actually attached to a ligament to a bone in your throat. And it gets calcified by putting your head down for long periods of time. And when it gets calcified, it is in between the atlas bone. There are blood vessels to the brain, the internal carotid artery, which is a major blood supply to the brain, and also the internal the internal jugular vein, which drains the blood from the brain. So if you have that calcification of that ligament and the atlas is rotated to that side, it will actually put pressure on those blood vessels and can cause TMJ, can cause all kinds of problems in the brain, actually, headaches, things like that.
So the poor posture coming from a forward head posture, it creates and generates a domino effect in our entire body, especially on rubbing the vertebrae, like calcification of the vertebra, especially that particular area that you are commenting. So the misalignment of the spine can actually create and cause lower jaw and protrude forward, and a bad bite, which is actually clenching the teeth, which I have a feeling I clench my teeth because my teeth are wearing off every time I visit my dentist. If you're actually interested to know more about this, you can come back last summer. I actually interviewed a dentist where we chat about clenching teeth, the connection of nasal breathing and mouth breathing, and beyond that, how our tone posture can affect our position. Going deeper into the atlas, if I'm somebody that I never been exposed to this practice, what would be the best way to approach to the practice, like finding a professional that is actually certified on EPIC technique, or what would be the best way to start with this new way of healing?
What I would do is I would go online and just look for EPIC technique. There is also epicclinics.com, which will go over like the basics of EPIC technique. It will show the instrument that we use with the sound wave, because when we move it back in place, it's with a sound wave that is painless. And patients, as you said, don't even know they got the treatment yet. They say that's it, but then they do feel the results of it. So I would look on that, and I would investigate online for EPIC technique. There is some YouTube videos where it explains EPIC technique. Podcasts such as yours, where I've been doing several podcasts where I'm telling people about this and educating them, because a lot of people, every day we get people who are suffering from TMJ problems, all kinds of problems, have been to a lot of doctors, and doctors can't find the problem, what the cause is. And the reason is because they're not trained in EPIC technique and how the atlas is out of place. Also, a lot of chiropractors, or most chiropractors, are not trained in that either. So that's why we're trying to educate the people. And EPIC technique is now being in a lot of the chiropractic schools. Little by little, we're educating them in the chiropractic schools, the students, so when they come out, they'll know how to do EPIC technique.
EPIC technique. And this is all related to the main vertebrae, but also to the main vertebra on top of the atlas, but also to the veins that you're commenting, right? You're commenting about the internal jugular vein that is primary vascular drainage of the brain. So basically, we are not only working on a physiological, but also on a neuropath, like how we connect into the brain, and are we actually able to concentrate when we're actually working, and how productive we are. Because definitely there is a correlation between back pain and mental health. 30% of people that are experiencing anxiety, depression, and any type of mental difficulty, it is related to our pain as well. Our body and our brain is connected so intrinsically, and it's so important to work it that way as a unit. I would love to know more about the TMJ, and I wanted to know one more case, if you remember one case that was dramatically changed in one of your therapies.
Yes. We had a young woman came about a month ago, and her pain was so bad she could hardly eat. She couldn't chew. She had gone to, I think, 7 different doctors. They couldn't really find anything wrong. Her partner was there, and he was just very skeptical because he had been told this is going to help or that's going to help, and mostly it was just pain medication which covered the symptoms but didn't really get to the cause. When we found the cause, he said, I really hope this works. After the treatment, she immediately felt the jaw loosen up. And when she came back the next day, she was all smiles. Before, she was like in very bad shape mentally. And I said, well, what does your boyfriend think of it now? And she said, he's very happy because he had actually taken her all over the country to see doctors for this problem without results.
And this happens only with two techniques, two practices of this.
Yes, EPIC technique is only practiced in New Jersey at my clinic, and in Florida there's like 2 clinics that use this technique. So it's actually becoming a franchise, so it can spread not only all over the country but all over the world. The doctor in Florida has seen, he's been doing it much longer than I have. He's seen patients from 38 different countries and like 40 of the states. People fly in and get treated because of the miraculous results that this technique gets.
Yes. So I guess this is a new way, especially using sound wave technology, that you perhaps can experience if you are willing to take those flights to New Jersey or Florida, since are the only 2 locations that so far is being spread this technique. There is definitely an upgrade of knowledge for all of us after listening to this conversation. And perhaps if you're curious, you can read more about it and go through one of the therapies, especially if it's so easy, only one therapy where you get all the x-rays and you get exactly the coordinates where the doctor will apply the technique. And then perhaps by the second therapy, you will be healed, or at least your pain will be reduced tremendously, as you were commenting with your case studies. I am so excited. I'm going to try to go down this year before winter to try it out. My listeners know I had scoliosis when I was 15 years old, 10 years of back pain, chronic back pain. I tried all, including anti-inflammatory, which I hate to take naproxen, but sometimes the pain is really, really, really strong. After 12 years of no pain, my pain came back a month ago, where I actually was diagnosed with 4 body discs and 1 slip disc and arthritis, which I didn't know. I have no pain until a month ago. I'm actually back into alignment one more time as the podcast, being positive and learning from the biggest teacher, which is pain. And I'm always positive that we will be able to decrease the pain, and I will be able to come back to living a life with no pain, which was amazing to have 12 years of no pain. But I am very excited to continue having chats with doctors like you, and I hope to see you sometime this year and and know more about this technique, actually living the experience, and perhaps I will have a great miraculous result. I wanted to ask one more question. I wanted to ask if in an ideal world, from 10 years from now, where do you see yourself as a doctor? If you can actually envision yourself, where do you see yourself as a chiropractor or brain doctor?
I see myself treating patients because I love doing that, but also teaching younger doctors how to do this technique and apply it properly. And I see myself managing many of these EPIC clinics throughout New Jersey. So people don't have to travel far. There are a lot of people who would come, but they're like 2 hours away, an hour and a half away, so it's hard for them. And that's one reason why Dr. Pierce, who started the franchise, did it because he was having people coming. Actually, I had sent many people to his office in Florida from New Jersey. And, he was concerned that, they're not getting all the follow-up that they should. And he just wants to expand it. And so do I, and help him do that.
Yes, yes. I'm looking forward to see more doctors with this technique. And I definitely so down to practice, actually to receive this technique. Especially I actually had a car accident that I felt a whiplash and had a nerve impingement on my neck. So perhaps my whole pain that is in the lower back, it could be related to my neck. And as you were saying, the connection to the brain is kind of like the gateway, right, on the atlas. So I'm actually really curious if it's, for some reason, that's the main cause of what's happening to me. But thank you so much, Dr. Pecoraro. It was four talks together. Thank you for your commitment to always show up and always to your positive spirit to share what you do. And yes, please don't stop doing what you love. Like you say, persistent is key. Thank you so much. Anything else? Any more that you want to share? Something else before we go?
I just wanted to thank you for having me on, and just acknowledge you because you care so much about your listeners and you're educating them, and that's the most important thing, because so many people are in pain and they don't know what to do, and they've tried certain things, didn't work, and now you're giving them hope. And I think that's very important. And I just want to offer, because I'm so passionate about this, offer your listeners a free phone consultation if they're interested in finding out more about EPIC technique, and they can go to goepicclinic.co. Goepicclinic.co.
Yes, that's awesome. So if you are listening to this podcast and you are really curious and you never tried this technique, try to have a consultation with Dr. Pecoraro right away. So you go to www.goepicclinic.co, goepicclinic.co, and then you can get to book a consultation with Dr. Pecoraro, and perhaps take a flight and get to do this technique that it only needs 1 or 2 therapists to be able to heal it. So thank you so much. And yes, we're here. We never stop. Remember that together we are stronger. Have a beautiful weekend, my friends.
We invite you to subscribe to this channel and share with your community. Please leave comments below, and if you like the episode, click the like button. Have a beautiful day.